Hello, everyone. Welcome to Gift of Health Weekly Wellness Chat. I'm Dr. Arjun Rayapudi, and this is my lovely wife, Dr. Shobha Rayapudi. We're both lifestyle medicine doctors and co-founders of Gift of Health, where we are helping people to prevent and reverse disease, get off medication treadmill, lose weight, keep it off, and have more energy with foods that love you back, with a lifestyle that's love you back. So today, we on a weekly wellness chat, we have a very special guest, uh, Dr. Deepthi Karanam, and I'll let Shobha introduce.
Yes. So today, like, we are really excited because Deepthi is bringing her expertise on a very important topic that is less talked about. So today she's going to talk about kidney diseases. Like, actually, Deepthi, I would say, she resides in California, and she practices in sunny Southern California, where she uses nutrition and lifestyle changes to prevent kidney disease. So not only to prevent, but also treat and reverse kidney diseases. So we are so excited that she is here with us today to share her invaluable experience and expertise. So welcome, Deepthi. We are so glad you're here.
Thank you, Shobha and Arjun, both of you. Thank you for having me on your weekly wellness chat. Both of your work is very inspirational, focusing on lifestyle changes, empowering your patients, and making their health a priority. What you both have accomplished is amazing.
Thank you.
Quick mention to your Gift of Health website. It's such a resourceful website, and I personally have used some of your recipes, Shobha. My household has approved them. So thank you for making cooking seem easy.
Thank you. Yeah.
Recipes.
So for our viewers, we want to let everyone know that Dr. Deepthi Karanam is a triple board certified. She is a board certified doctor in internal medicine, in nephrology, and lifestyle medicine. And we're also proud that she comes from the same medical school that we went in India.
That's right. That's right. So proud of that.
It's so surprising that because we found her as an expert in this field, and then we realized that, hey, we come from same roots. So it's
alumni of the same medical school.
Yeah. Excellent. Yeah.
Small world.
Yeah.
Yes,
You're doing amazing work.
Thank you. Thank you. So just a little bit about myself. I'm a board certified nephrologist, and my interest is in lifestyle medicine and plant-based nutrition. And so some of you may be thinking, so who is a nephrologist and what is lifestyle medicine? So nephrologist is a physician that specializes in kidney disease, and lifestyle medicine is using evidence-based changes, eating better, moving more, coping with stress, adequate sleep, using all of these to not only prevent, treat, and even reverse diseases. A lot of diseases are lifestyle diseases now, and that's what we need to focus on.
That is so true. This is something that we have observed again and again, that like more than 80 to 90% of our patients that we see in our hospital and clinics are due to poor diet and lifestyle.
That's true.
Right. And especially with kidney disease, chronic kidney disease is one area where majority of the causes are due to poor diet and lifestyle. So we thought having you to focus, we talk a lot about diabetes and heart disease, and we have had so many talks around this, but we haven't dedicated a whole session on just focusing on the chronic kidney disease. And
also, this is something that is very difficult to recognize. I mean, when it comes to heart disease or anything, there are symptoms, and it is something that we can quickly recognize and see what we can do about it. but like we don't have much awareness about the kidney diseases, like what we should be looking for, or even so. Deepti, maybe like can you just let us know like what is kidney disease, in
And
the yeah,
what kind of kidney diseases do you see in your practice?
yeah.
So before we get into the kidney disease, let's talk a little about the kidneys. So the
Yeah,
kidneys are highly vascular.
absolutely. Yeah.
Kidneys are highly vascular. They receive a lot of blood supply. They filter blood throughout the day. We all know we have two kidneys, and they're about the size of the fist. There's one on either side of the spine. With kidneys, 9 out of 10 people that have kidney disease don't know that they have it. And kidney disease initially does not cause any symptoms. So it can go undetected for a very long time without even knowing that we have it. So that's why it's very important to bring awareness to kidney disease so we know about it and we can find ways on how to get tested. So coming to the kidney, so what do kidneys do? They do a lot of things. They multitask. So
Yeah.
you like me, they're constantly multitasking. They remove waste products and they remove excess fluid from the body as urine. They regulate the acid-base balance in the body. They help control the production of blood cells. They help control the production of red cells, blood pressure. They do a lot of things. Electrolytes, sodium, potassium, they're all regulated by the kidney. If the kidneys were to stop functioning, all of these things that they do stops, and it causes an imbalance in the body, and which can eventually lead to death. So that's why it's important to know about that. And yeah.
Absolutely, yeah. I see like on the side some comments from our viewers, like Dr. Mithika, she's saying, looking forward to hearing you, Dr. Karanam. Yeah, Dr. Kanbar, she was on the Gift of Health Wellness Chat just a few weeks ago.
I
Thank you
have
for that.
I have learned so much from Dr. Kanabar about not looking at the screens, and I actually joined her screen challenge too. So
Yes,
trying to
absolutely.
work on screen time with her.
That's good. Excellent. Yeah. And Connie says hello. Pearl says hello. Hi.
Hi,
Hi,
Connie.
everyone.
Hi, Pearl.
Let us know where you are joining from. And we are talking, for those of you who are joining just now, we are talking about chronic kidney disease and how to use food as medicine for chronic kidney disease. So invite your friends and family, share this widely, like us, give us a like, give us a thumbs up so that like it will reach more people. Okay.
And for one of the questions, we are from Los Angeles, and that's where I am from.
Yes.
Yeah.
Good, excellent. Yeah.
Yeah. So, like, given like kidneys, they perform such an important job. So, like, what factors do you think affect the kidneys, or like why our kidneys are get into trouble in the first place?
So 60% of the total body weight is water. So for the kidneys, when they're doing so many of these things, they're regulating, they're removing excess fluids, they're monitoring the electrolytes, they're doing a lot of things. So they need water to function. Adequate water intake is very important. And even though the 60% of the body weight is water, over time, when we gain weight, we have increased fat percentage in the body and this decreased water content. So obesity actually predisposes you to have low water content in the body. So more the reason when we are overweight or obese, the kidneys are strained because there's not enough water. So we have to make sure we are hydrated enough, drink at least 60 ounces of water. The exception would be if somebody has heart disease, then you have to be careful with how much water you're drinking. But hydration is very important. And the two main causes of kidney disease are diabetes and hypertension. Both of them are lifestyle related diseases. And that's why we need to emphasize on controlling diabetes and controlling high blood pressure. One in five patients that have heart disease are prone to get kidney disease. Likewise, 1 in 3 patients with diabetes may develop kidney disease. So the risk is very high, and it's important to be aware of it so we don't progress further and we can change the course of the disease if we know before.
That's very interesting, Deepthi. So it's really important that if we are diagnosed with diabetes or hypertension or heart disease, so we should be mindful about getting the kidney disease, or being mindful like how we can prevent kidney disease. Like if we look at diabetes or hypertension, like there are some things which indicate us that like we have the disease, so either a high blood pressure or high blood sugar. So what are the things that we have to look for to indicate that like our kidneys might be in trouble?
Good question, Shobha. And to answer that, the only way we can detect kidney disease is by doing tests, blood tests, urine tests. These are very important to find out about the kidney function. If we are not tested, then there's no way to know unless we have symptoms. And sometimes it may be too late by the time we have symptoms to find out about kidney disease. So the two things to look for in the blood test, one is a creatinine, and creatinine is a waste product produced by the body. The second one is a GFR. That's a calculated number that gives the percentage of kidney function. So the next time you look at the blood report, look at creatinine, look at GFR. If my GFR is 40, that means both my kidneys are working at 40%. So if your GFR is at 30, that means your kidneys are working at 30%. And it's important to know what percentage the kidneys are working, because based on that, we determine the stage of kidney disease, which we'll go into later. So the second kind of test that we need to get done is the urine test. In the urine, we have to look for any protein or any blood in the urine. A good functioning kidney filter will keep all the protein in the body. Protein, they're building blocks. We need protein in the body. So a good filter holds it, but when there's damage to the kidney filter, protein leaks out into the urine. That's a sign of kidney disease. So blood and urine tests, especially if somebody has diabetes or hypertension that predisposes them to kidney disease, they have to have tests done at least once a year.
And what you shared is, it seems so simple and easy to remember, like the EGFR, which is how we measure the kidneys are functioning. It's a measure of the kidney function, and people know these numbers, like, look to keep the EGFR above 60, but you gave a simple equation, like, if the EGFR is about 30, that means kidneys are functioning at 30%. And so that's a good way to, so it also, gives as an information, like most of the time we are focused on keeping the EGFR above 60. So is there any benefit of keeping the EGFR 80 versus 60?
So yes, that's true. So going into that brings me into the stages of kidney disease. There are a total of 5 stages of kidney disease. Stage 1 is close to normal function, and that's anywhere from 100 to 120. Stage 5 is when the kidney function drops to less than 15%. When it goes to less than 15%, that means it's kidney failure, also called end-stage kidney disease, where we need either dialysis or transplant to sustain life. So when the kidney functions over 100%, great, it's stage 1. If it drops slightly lower, then it's stage 2. Once it drops below 60%, starts with stage 3, and then stage 4 is severe kidney disease, eventually leading into stage 5, which is kidney failure. So the higher the number, the better it is. Yeah. We don't want the number to drop and head towards 15, then we are heading towards dialysis. So by optimizing the risk factors and by controlling things, we can keep the numbers stable. And that's what we'll talk today, how we can keep the GFR as high as possible.
Yeah, it's like your scorecard, your kidney scorecard. Yeah. Are you getting the first rank or second rank or third rank?
I actually have patients come in my office and say, so what's my number today? Is it good? Is it bad?
Yeah. It's yeah, let's dive in.
Yes, yeah. So what are the things that we can do, Deepti, to improve our scorecard?
Scorecard,
Kidney
right.
scorecard, yeah.
Yeah.
So one thing is who are prone to kidney disease. So we don't have to wait until our numbers are bad to do something about it. And by screening, by getting our tests done earlier, we know if we are at risk for kidney disease, then we can start looking at that point. If we are diagnosed with kidney disease earlier, the outcomes are better. So we can work on what needs to be addressed. If a person has diabetes, or if they have high blood sugar, blood pressures, or if they have heart disease, they have high cholesterol, even if they're overweight or obese or have a family history of kidney failure, all of these puts them at high risk. So that's when they have to start getting their blood tests to look for it. And let's say if somebody is already diagnosed with kidney disease and they have about 30% kidney function, stage 3 kidney disease, then they have to optimize their risk factors. With kidney disease, there's no one pill that reverses the kidney function. We have to address the underlying risk factors. So bringing your hemoglobin A1C to an optimal level, to a control level, controlling the blood pressure readings, and sleep also regulates the kidney function. So all of these are important to help keep them stable. Animal protein, we need to talk about animal protein. There's overwhelming evidence lately that says more plant-based foods help prevent and even decrease the progression of kidney disease. Animal protein, what it does, it increases the acid load in the body. It increases the phosphorus levels. It causes the kidneys to work more. In other words, it's called hyperfiltration. So when we are eating a lot of animal products, we are straining the kidney, and that causes it to fail faster. The animal protein, animal fat, cholesterol, Harvard researchers have shown that these are the 3 most important factors that we can address to decrease the progression of the kidney disease. The National Kidney Foundation has the same stance on it. So we have to pay attention to not just the quantity of the protein, but the quality of protein also is very important.
So, Deepti, are you saying that eating chicken, cheese, butter is not a good thing for the kidneys?
Coke also, add Coke to that.
Yeah.
Phosphorus, Coke has the highest amount of phosphorus. Just like animal proteins, they have high phosphorus. High phosphorus by itself is an independent risk factor for mortality in somebody that has kidney disease.
Yes.
So
No,
it's
we just said like
so it's like all the more good reason to avoid soda, Coke, pop.
That's right.
So yes, because a lot of us don't realize, like when we are drinking that Coke or soda, that like it might be damaging our kidneys. So that's a very beautiful point you brought out.
yeah.
And I know
So
like
yeah, see, the thing is, soda is something that's bad. Many people know, but like I want to stay a little bit on how chicken, cheese, butter damage your kidneys. Right? It's not something that many people realize, that how animal protein. Sometimes when we use this word animal protein, people don't understand what is animal protein. I'm just saying, hey, animal protein is basically chicken, cheese, eggs and turkey, beef, pork, any animal flesh, the dead, rotting, decaying flesh is animal protein. Yeah. So that is, as you shared, it increases the acid load overall in the body. And I know my primary work in the hospital is the general surgery and GI, gastroenterology. What I observe is that with the more intake of animal protein, it takes more acid production by the stomach, because to digest the animal protein, we need to have an activated form of enzyme, the stomach enzyme called pepsin, and for that to be active, the stomach has to make a lot of acid. So one of the common things that I see in my clinic is acid reflux. So common, and almost always after a meal of chicken, cheese, and like a heavy meals in the evening supper time. So how all these things are connected within the body, bringing them, integrating and understanding, and how each of these different diseases are connected. It's
Yeah,
so
it's
relevant.
amazing. Yeah.
It is very relevant, all of them. Diabetes and hypertension being the most common causes of kidney disease, they account for 2/3 of the cases. The way diabetes damages the kidney is it affects the blood vessels in the kidney. The way high blood pressure does it is it affects the blood vessels and causes decreased flow to the kidney, damages all of the blood vessels inside. Animal protein, like you mentioned, the saturated fat in animal protein, the high cholesterol. Just on a side note, animal products are the only products that have cholesterol, high cholesterol in them, high saturated fat. So all of these, they clog up these microvasculature. So when the small blood vessels are being affected, it's not just the kidney that it's being affected in the eyes, in the heart, the nerves are being affected. So the whole body, it's not that diabetes or high blood pressure, they're affecting specifically the kidneys. If we have kidney disease, it's almost evident that the microvascular changes, the microvascular damage is already there. Retinopathy, neuropathy, heart, it's everywhere. So like you said, Arjun, all of them are interconnected: diabetes, high blood pressure, animal protein, microvascular changes. So they all go together. That's why it's very important that we need to be mindful of what we are eating, what we are putting in our body. And health needs to be our first priority, pleasure the second priority. Easier said than done.
Well, but we also share that, hey, you don't have to compromise pleasure,
Mhm.
because you could make almost all the healthy foods that are tasty. So, I mean, we'll come to that, like,
Yeah.
how to do it. But as you shared, like, Deepti, like how all these things are interconnected. I think it's important to recognize that once you have kidney disease, that means you're dealing with a systemic disease. If kidneys are sick, that means the whole body is sick, right?
Yeah.
Yeah.
And now the prevalence, the global prevalence of kidney disease is increasing. It's 15%. So
Wow.
at least 37 million adults in the United States have kidney disease. And according to Kidney Foundation of Canada, 4 million Canadians have kidney disease. Of the 4 million Canadians, 51,000 have kidney failure. And I was looking up some data in Newfoundland, as per Kidney Foundation of Canada, the growth rate of kidney disease is 10% annually, as reported.
Wow, that's a
Wow.
good stat. I mean, I shouldn't say good. That's like an alarming statistic to, one thing that we need to worry about. 4 million Canadians, 51,000 people kidney
Have
failure.
kidney
And like
failure.
Newfoundland has the highest percentage per capita in terms of diabetes when compared to rest of the provinces in Canada. Highest amount of hypertension in terms of percentage compared to other provinces in Canada. And how this diabetes and hypertension contribute to this kidney disease and how they raise the prevalence. This is something that I see in my, not as a direct professional practice. I'm not a kidney specialist, but the thing is every day when I park my car from my parking lot, when I go to enter the hospital, I have to walk through the dialysis unit, right? I have to walk by the dialysis unit. And every day in the morning and evening, I'm seeing people sitting in these chairs, hooked to the dialysis machine. And they're sitting there for 3 hours, 4 hours every day, and not, every other day, almost like, 2 to 3 times a week. And sometimes I wonder, like, hey, 4 hours of your time is gone, right? Just and like sometimes people wonder, like, I don't have time to make a healthy food for myself. Then I'm like, if you don't make time now to take care of your heart and kidneys and your body, this may be the scenario. Like, you'll need to you'll be forced to,
Yeah.
sit in a like a chair for 4 hours, 3 times a week to take care of the kidneys.
You've put it so beautifully, Arjun, and I've had patients come to me, especially when they're diagnosed with end-stage kidney disease. And usually once they reach the 5th stage of kidney disease, they have to have either dialysis or a transplant to stay alive, to sustain life. And once it gets to that situation, dialysis it's a form of removing the waste products and the water from the body artificially. So if the kidneys stop working, we're not putting out as much urine, all the fluid, the tea, the coffee, the soup, the broth, the food, everything that we have, there's no way for it to be eliminated from the body, and it accumulates and can cause respiratory distress. So they have to have dialysis. It's artificially cleaning your blood, taking off the excess fluid. I still remember I've had a patient come to me, and after understanding about dialysis prior to starting, that scenario still is so vivid in my mind. And he said, do I have to give up my life to stay alive? So those words still ring in my ears. It's pretty much, once you're on dialysis, there are 2 kinds. What you described is the hemodialysis, where they have an option of going to a unit 3 times a week, about 4 hours each treatment for the rest of their life, unless they get a kidney transplant. And the second form of dialysis is peritoneal dialysis, where there's a catheter in the abdomen, and they have to connect to the machine almost every night to remove the waste products. So between these 2 forms, and that's a lot of time, and the transportation, going to the dialysis, the time there. Suppose somebody from the previous shift gets delayed, their time gets delayed. So it's a lot of things. Again, it's great that we have something that keeps us alive when the kidneys totally fail. But if we can avoid getting to that situation, that would be the best thing to do. And even through the practice, I've seen patients that come in for the first time, they come in for a consultation and they have stage 5 kidney disease. And as we are talking, they just stay silent for a few minutes and say, if we knew we were getting into this situation, we would have worked harder, we would have done something different. We never thought we would be in this situation where you have to make life and death choices. So
that is a sad situation, right?
Yes,
because
yes.
As you shared, that kidney function, like kidney disease, is not something that is recognized in the early stages, because uh, our bodies are so resilient that, like, even when you have a 40%, 30%, 35% functioning kidneys, we may not feel it, right? Like symptoms wise.
That's true. That's
Yeah.
right. We may not feel any of that. And with all of what we described, dialysis, it's not great. But again, for those that have stage 4 kidney disease or that are on dialysis, that doesn't mean that they're doomed or there's nothing that can be done. Even at stage 4, even at stage 5, eating healthy and eating a plant predominant diet and being mindful of what we are doing, it helps have them a good overall quality of life and good functional capacity.
Yes. So, like,
So why don't we talk about, like, what is that we can do to prevent getting to that stage?
that's right.
Because-
Yeah, and we'd like to know, Dipti, like, at every stage, like, what are the things that people can do, right? Let's say stage 3 is something that is early, and then stage 4, like, these are the most common ones that are the stage 5. Like, can you give us an idea what are the things that we could do at every stage, and maybe if you could share some examples of your success stories that you had.
Absolutely. So in terms of kidney function, on how we can keep it stable, or what is it that we can do? So for stages 1 and 2, in those stages, what we want to mainly do is risk factor modification. Stay healthy, eat good. When we say about eating good, what that is cutting back on processed foods, cutting back on salt, on sugary foods, Stimulus control is important. How many of us can relate to having a long day at work? We come home and then we just reach out for the first thing that we see, and then we're not eating because we are hungry. We are eating because we are tired. We deserve it, and we are stressed and all of that. So having good options at home, starting at the pantry, have fruit, have vegetables, have good snacks that you can use throughout the day. That stimulus control is very important. Apart from that, eating a diet that's predominantly plant-based, more fruits, more vegetables, beans, lentils, whole grains, nuts, and seeds, very important. There's a study that showed that replacing one serving of red meat with one serving of legumes by itself decreases your risk of kidney disease by 31%.
Wow.
Wow.
So, and we're not saying
So basically, what we are saying is like, swap out your chicken
with
with
beans.
with chickpeas,
Legumes.
or like, swap out your beef with beans, and then you could just lower the like the protect your kidneys so efficiently just with one serving. Huh?
Yes, and
And
also
it's
like yeah, as you mentioned, Deepthi, like using whole grains, legumes, beans, lentils, fruits, vegetables, nuts, and seeds. In terms of like, we might be thinking, oh, this is sounding boring, but like using these ingredients, we can make burgers, fries, pastas,
stir fry.
lasagnas,
Yeah,
yeah,
soups and stews
stews.
and stir fries and sandwiches, whatever. You don't have to like miss out, like,
Yeah.
people don't have to miss out on their favorite foods. Using these whole plant ingredients, we could mix and match and make so many tasty things.
Yes,
Yeah.
that's right. And I've had patients that come in and say, I don't like too many vegetables. I don't like vegetables. And what I say usually is start with what you like. Start with 3 or 4 vegetables that you like, and then slowly experiment, slowly incorporate more things. But if we have to say fruits and vegetables versus dialysis, it's a no-brainer. It's a no-brainer.
Yeah. Yeah.
Then they said, okay, I can try 2 more vegetables.
Yeah.
So that's how I get their attention.
Yeah. Yeah, that's a good way to put it. Like fruits and versus
Dialysis.
dialysis. Like sitting in a chair for 4 hours at a time, 3 times a week.
Right. And also, once they are at stage 3, which is slightly below the 60%, not only diet, again, focusing on physical activity is also important. And physical activity doesn't mean we just stay inactive throughout the day and go for a walk in the evening. There's data that shows we have to be active throughout the day. And cardiovascular exercise is important. It's not just that stretching, resistance training, balance, and all of these, it helps strengthen the body. It helps with the gait. It prevents falls. So in that way, addressing all of that is important. And we need to set realistic goals. When I have patients come in that are exercising 15 minutes, 3 days a week, that's great. That's a great place to start at. So each one, they have to start where they are and slowly build upon it. And hiking, biking, walking, whatever we're able to do based on where we live, I think that's great. Once we reach stage 4 kidney disease, what happens is there's more acid production, because as the kidney functions declining, acid production happens. We develop metabolic acidosis. We develop high phosphorus levels because the body is not eliminating adequate phosphorus. And we start to see some water retention in the legs. So for that, again, what we can do is fruits and vegetables are equal to sodium bicarbonate. There's data showing that the prescription of sodium bicarbonate that's given to patients with decreasing kidney function is equal to having 2 to 3 servings of fruits and vegetables. And because the plant-based diet is very alkaline, it's acid neutral, it neutralizes the acid. And in that stage, taking more pills, usually we prescribe sodium bicarbonate, but instead of that, by changing the way they eat, they're able to control the acidosis. And once they're further down to stage 5 and they're on dialysis, again, not everybody has the same kind of labs when they're on dialysis. If somebody has high potassium, they have to be mindful of what they are having. So even though we're saying the plant predominant diet is important, your blood work is equally important. If you have high potassium, we have to be careful. And usually the problem comes when, let's say we are drinking orange juice. That's pure potassium extract in there. If you're having one or two oranges here or there with the fiber, that's okay. But you can't go to juicing when your kidney function's very low and just have like juices of like oranges or add avocados too much in the smoothies.
So these are very, very, very important and enlightening things for anyone like who has borderline kidney function. So I want to focus on what you shared, like for stage 4. Stage 4 is where the kidney function is EGFR. The glomerular filtration rate is 15 to 30%, right? Yeah.
Correct.
So while that stage, in stage 4, we are not looking at dialysis. Usually stage 5 is where, like when the kidney function drops below 15% is where where you recommend going on dialysis, right? So for when you are in stage 4, do you have to worry about, like, if the potassium levels are okay, you don't have to worry about avoiding any high potassium foods, is that right?
Absolutely not.
Yeah, because this is a common question that comes for so many people. Hey, I have a borderline kidney function, and my doctor said to watch the foods that are high in potassium.
Yeah.
Yeah, and the other thing that you shared that I thought was so fascinating is that your fruits and vegetables access sodium bicarb, like to counteract the metabolic acidosis. Hey, it's like a testament that how the nature put the best medicines in the fruits and vegetables. Like people know that fruits and vegetables are good for them, but then many people fail to realize how important they are.
And not only that, like having them in the whole form, as you
Yeah.
said, instead of juicing. So it's better to have the fruit as a whole. So this also brings up an important question, Deepthi. So how about, like, do nutritional supplements affect kidneys? So like for people who take in the form of supplements or other things?
Absolutely, nutritional supplements do affect that. And just quickly going back to what Arjun has mentioned about that, that's a myth we have to debunk. And most times, patients, if they have kidney disease, they look up online or they've been told that you cannot have any potassium, you can never touch a banana again, you can never have an orange again or an avocado. So it depends on the blood work. If their potassium is normal, there's no reason to restrict it. You can't have 4 or 5 bananas a day, but just eating a well-balanced diet is not a problem at all. For specifically for patients that have high potassium, they have to be careful with what they're having. And that's a myth. Definitely we have to debunk. Not all patients with kidney disease have to never touch potassium.
So, is there any role for a plant-based diet? Like this is actually from Dr. Kanabar. Like, is there any is there any role for a plant-based diet on patients already on dialysis?
Absolutely. So even for patients that are already on dialysis, if we are not paying attention to how much salt we are having, if we continue to have processed foods, or even if we have refined grains and animal protein, there is more acid load, there is more water retention from the sodium, and they have to do more dialysis. So despite being on dialysis, if we are eating a diet that's rich in plant protein, decreased salt intake, that helps them. That helps them meet the clearance well. There's also something called residual renal function, where despite being on dialysis, they can have a little bit of urine output. And by eating a healthy diet, we can increase the residual renal function or prolong the time that they have the residual renal function.
On this note, like I really want to share a story of one of the patients that I had. Like this patient, I saw him like 3 years ago, and he had long-standing diabetes he was only in 50s, and he had long-standing diabetes for over 15 years. He was on over 54 units of insulin, and he came with like a septic diabetic foot, like quite a bit of infection in his foot. And on top of that, he ended up having a fracture of his calcaneal bone, like the heel bone. So we had to do quite a bit of debridement, like cleaning up and putting him on antibiotics. And his kidney function also was at about 15%, like 50. His EGFR was 15, creatinine was 404. So the nephrologist suggested, hey, uh, uh, prepare him for dialysis. Like, so they were planning to put a catheter in him to get him dialyzed. And meanwhile, the debridement that I had to do for his heel, so because of the calcaneal bone, it ended up leaving he had a huge gap at the heel, and it needed to be covered, and we wanted to get an opinion from a plastic surgeon and an orthopedic surgeon what to do. And the consultant surgeon, they saw him, and that their opinion was that this guy should go for amputation. Like, there is no point in like trying to save the foot, because there is so much of tissue loss and there is no way it can be covered. And his kidney function was like at 15%, and he was inpatient in the hospital. And at that time, I talked to him, hey, there is evidence showing that a plant-based diet can help with improving the blood flow, and evidence showing that it can improve the kidney function, improve the healing. You are at a stage where would you be willing to try? There is what's there to lose? And he's like, hey, what's there for me to lose? I'm going to give it a try, because he's only in 50s, and the other prospect of was like losing his leg and going on dialysis. So while he was in the hospital, we changed his diet, and he started eating a plant-based diet while he was in the hospital. And our hospital cafeteria prepared him plant-based meals with like no animal protein, like made different soups and salads and sandwiches, and loaded with like plant-based foods. So while he was in the hospital, within those 2 weeks, he was in the hospital for 2 weeks. His blood sugars were plummeting, and we had to cut his insulin dose by 80% in those 2 weeks. And his leg also started healing. The foot started healing. Healing was faster, and his creatinine, the EGFR, went from 15% to 29% within a span of like over 3 weeks. And in 3 months, he came off of his insulin, and it's been over 3 years, and he still got his leg. He avoided going on the dialysis for more than 3 years. Like recently, his like kidney function got a bit worse, where like the nephrologist suggested to go on dialysis, but his dialysis was delayed from then to almost 3 years.
That's an impressive story. That's a great story, Arjun. And what you have described reiterates our body's ability to heal itself, provided we nourish it and nurture it. Mm-hmm. So we underestimate the ability of our body to heal, but by providing the right foods, we can help it recover. Or we can continue to choose to have the wrong foods, fuel inflammation, and just go down the path that we don't want to go. And if he had not changed, then we would have been on dialysis. And yeah. So it's very amazing what our body does, but we have to give it the right fuel.
Absolutely. Yes. Yeah. Our bodies are so good at healing themselves when the healing happens when we give the right fuel. Right. Yeah. So there are a couple of questions here, Deepti. We keep saying you Deepti. It's Dr. Karanam anyway.
Please, that's okay.
Yeah.
So, quick thing with regards to Shobha's question, I just want to touch on nutritional supplements, because the supplements are like a multi-million-dollar industry out here, and what we need to know is not all the supplements are not regulated by the FDA. They don't need to undergo pre-market safety testing. They don't need strict labeling. They don't need to report any adverse effects. So what happens is for somebody that has a normal kidney function, they may be able to take the supplement. But if another person's kidney function is low when they take the same supplement that they heard great stories from their friend, it may not be good for them. It may damage their kidneys. And there's a lot of contamination with heavy metals that we see, lead, arsenic in the nutritional supplements. And recently we've had so many reports about adulteration, about impurities in the supplements. So before you take any nutritional supplements, please make sure you talk to your doctor about it. And it's very important that nutritional supplements I've seen cause kidney damage, interstitial nephritis, tubular damage. And so it's important to pay attention to that.
Absolutely. Yeah. Supplements is such an unregulated field, and so many additives, adulterated versions, and it's so. And there is not much research showing that taking any supplements for any kind of conditions is beneficial unless you have a deficiency.
That's right.
Right?
That is
Like, no, it's we are into a mentality, like as a culture, that taking more is good. Like, especially like, I know I want to take in more. Can these nutrition supplements help? But vitamins and minerals, yeah. But the best way to get the vitamins and minerals, we say, is to through the food, through the nature.
diet.
Yeah.
Yeah.
Excellent. Yeah.
Yeah.
So
So we have one question here, Deepti. So what is the best way to eat for people with hemochromatosis?
So usually with hemochromatosis, what there is there's excessive iron, and over time, the higher the iron, the more the inflammation in the body. And hemochromatosis, or even patients with autoimmune disease, where there's just so much inflammation, iron is oxidative stress on the body. So following a diet that is that has phytonutrients, that has more fiber in it, that has more vitamins, more minerals, it's nutrient dense, and all of these foods will help bring the inflammation down. So the main thing in autoimmune diseases or any diseases where inflammation is there, bringing the inflammation down will help disease stay stable, and it prevents its progression.
it's excellent. Yeah. Just in addition to that, like so the iron that comes from the animal foods is more oxidizing, right, compared to the iron that comes from the plant-based food. So it's the correct me if I'm wrong, like the iron from the animal protein is the ferric form,
Correct.
the heme iron. Whereas the iron from the plants is the ferrous form, which is more protective. And this is also important, like for many people who have low iron, sometimes they might hear that, hey, you should eat more meat to raise iron. But here is the thing, like when you eat meat to get more iron, you're getting more oxidized form of iron, which is damaging, causing more inflammation, more autoimmune disease, more kidney damage. So why take something that might raise iron but still damage different parts of the body? Instead, go for plant-based iron, where like you get, eat beans and greens and raisins and molasses and the nuts and seeds, where there is a lot of iron. And we also suggest, like, focus on increasing intake of vitamin C rich foods, which helps in the absorption of the iron. So this is, I mean, we club two things, like the iron deficiency and hematochromatosis. But anyway, whatever the thing that you're looking for, going for a more plant-based foods and less of animal-based foods would be the best way to go.
Yeah. Absolutely. And what I would like to mention, just like you said, even kidney stones we can bring into the picture, where if somebody has kidney stones, what they need to do, the most important thing, water, at least 3 liters of water every day. Along with it cutting back on animal protein and cutting back on salt. What animal protein does is it increases the oxalate in the urine. So that's another reason to decrease animal protein, specifically for patients that have kidney stones. And also, if somebody has kidney stones, they're prescribed potassium citrate. Potassium comes from fruits and vegetables. Citrate comes from fruits and vegetables. So here we are buying potassium citrate where we can get it from a well-balanced diet. So now I see a pattern: sodium bicarbonate, potassium citrate, and these are all adequately found in a well-balanced plant predominant diet.
That's a beautiful point. Like, so you don't need to go for potassium supplements, just eat fruits and vegetables. Yeah?
And I'm glad you addressed about kidney stone, because we had a question like, I got a kidney stone after being on Atkins diet, and so did my brother. I didn't think I drank enough water. So
And this Atkins diet, and the other names of Atkins diet, the modern names for Atkins diet, ketogenic diet, paleo diet, these are so lithogenic, which like which is, they promote the formation of kidney stones, right?
That's right. And that's why it's very important. The higher the protein, the more strain on the kidney, higher filtration. When we cut down the carbs, what we are increasing, if we are on like 0 or 20 carbs diet, a keto or a paleo or all of these diets where there's high protein, is hyperfiltration. Kidneys have to work harder. It increases oxalate in the urine, kidney stones, kidney failure. So increasing the protein by itself and increasing fat, saturated fat in the diet is not good for kidneys and not good for overall health.
Yeah, just to emphasize that, like when we're talking about saturated fat, for our viewers, we're talking about butter, cheese, chicken, and margarine. Like these are the foods that are not good for the kidneys, right? So it's I think we just come to the same things from so many angles, right?
yeah, so yeah, whether we think about heart disease or diabetes or hypertension and even now kidney disease, so like it's just so important to know that like what we are putting in our mouth does affect all these organs, and if we can give nourishing foods that love us back, like we can take care of all these conditions.
Yeah, we have to be more. Usually we tend to be reactive. We wait until something bad happens and then we want to do something about it. If we shift our paradigm and if we move towards a more proactive approach, or we don't have to have a loved one or a family member have kidney disease. If somebody that we know is overweight or obese or have diabetes or they have high blood pressure, heart disease, then we need to be proactive. Ask them about their diabetes, ask them about their blood pressure readings, be their support system, go on a walk with them, help them with their food habits. And you cannot empower them and help them make small changes, but that are sustainable. We don't want to wake up tomorrow morning and say, because Dr. Karanam said or Dr. Rayapudis said, I'm going to stop everything and try to eat the best. And if we try to do things so dramatically, sometimes we may not be able to sustain it. Some can do it, some may need time. Start at your own pace. And I think that's what I would tell everybody. Even if it's one behavior or one habit that you're addressing, start where you are and improve upon it.
So well said, Deepti. You just hit the nail on the head. And also, like, for people wondering, I mean, just to help people, we have placed programs in place, because making lifestyle change is hard, and especially when we don't know like what to do. And even sometimes we know, sometimes we have the knowledge, but like getting the skills and the support is a very big factor when it comes to like making that lifestyle change sustainably. So that's why actually we have created programs for people so that they can make these changes sustainably and reverse. So basically when they're targeting their hypertension or diabetes or heart disease, they're actually able to prevent other complications and also like save other organs. So I mean,
Yeah, so to emphasize what Deepthi said and what you're saying, like it's better to go a gradual approach. Like
yeah.
if you are doing things on your own, like trying to change your diet and lifestyle, um, all of us all in at once can cause overwhelm and frustration. So doing like what are the things that are easy for you, start cutting them out. What are the things that you can easily add, start adding, and getting more support, more information, learning more. And we on our Gift of Health website, we have over 250 recipes that are free, and these are plant-based and oil-free, tasty soups and stews and stir-fry sandwiches, whatever you want to make, they're there. So I want to hear, Deepti, like, what is, do you give any specific advice to your clients? Like, where how do I get started? And like, what are the things that I could do? Um, what kind of advice do you give for people, someone who are willing, hey, they're motivated, willing, and they want to make changes?
Changes. Of everything, the three things that I would say, just the three take homes would be increase your water intake, increase your fiber intake, cut back on animal products and dairy products. So those are the three things. If of everything we talked about a lot of things, but those three things are very important. And start instead of trying to figure out new things and trying new recipes, start with what you like, try to make them healthy, and find ways you can substitute animal products. What else can you have a little bit of tofu in it? Can you add a little bit of mushrooms, or however you would like it? Cutting back on animal products, increasing your fiber intake, and increasing your water intake will help the kidneys.
That's so beautifully summarized, because I think that answers the question. There is a other question, says, what diet do you suggest for stage 3 kidney disease? I would suggest the view, the Lori posted that question. Lori, go back to the recording of this, like, once after this live is done, like you could watch it. Go back. There is a lot of nuggets of wisdom in the whole talk. You can catch up, but Dr. Deepthi summarized it so beautifully. More water, stay away
More
from the stay away from the animal protein, which is basically cheese, butter, cheese, meats, and more plant-based foods, like more plant protein, whole grains and beans.
And like increase your fiber intake.
Yes, that will take care of, that will work for every stage, would you say, right? Stage 1,
Yeah,
2,
absolutely.
3, 4. Yeah.
The higher the fiber, if we can have 30 to 35 grams of fiber, compared to having 15 to 20 grams, high fiber intake, there's more benefit. The CKD progression decreases by almost 30%.
That's amazing. Yeah, just and raising the fiber by 15 grams is not that hard. All you
No,
got to do is, like, a cup of oatmeal a day. You add a cup of half a cup of bean soup, or a chili. Some foods that, like if you're eating Indian foods, like more chickpeas, more lentils, more dal, and you'll get all that fiber and protein.
I would tell my patients, count how much fiber you're having. And we always tend to overestimate. We feel like we are eating a lot of protein, but when you actually do a 24-hour recall and write down, and then they look at it and be like, oh, we didn't think we were eating so little. So do a 24-hour recall, increase your fiber intake.
Yeah. And there are people wondering, like, hey, where do we start? Like, how do we do this? See, sometimes changing these lifestyle things can be so hard, difficult on your own. And for these, like, we have dedicated our like lives through Gift of Health, where we are we have a 6-week food as medicine program, where it's a you can have an individualized, customized journey of starting a plant-based approach. And what you could do on your own to adopt a plant-based lifestyle, like what you could achieve in 6 months to 1 year, we could show that in like 6 weeks. And hundreds of people have taken the program, where they have reversed diabetes, come off of medications for blood pressure, high blood pressure, acid reflux, arthritis, autoimmune disease, even improved kidney function. So we highly recommend the you could look up on the Giftofhealth.org, the 6-week Gift of Health experience program, or the food as medicine program. So we will. Many people are, commenting, Deepthi, like how wonderful it was, excellent presentation. Do you have any closing thoughts and comments that you would like to share?
Yes, I would like to conclude by saying diabetes and hypertension are lifestyle related diseases. They cause 2/3 of kidney problems. So if we eat a well-balanced diet, be active, cope with our stress, sleep better, have positive social connections, and avoid substance use like tobacco, alcohol, our health will be better.
Yeah, wonderful.
Wow,
Yeah.
Any
excellent.
questions, I'm more than happy to answer, and I'll share my Instagram handle, and we can.
Sure.
Absolutely. Thank you. So you can follow Dr. Deepthi on Instagram. And thank you so much, Deepthi, for joining us and for this eye-opening discussion on kidney disease, one of the less talked about. Like as we shared, like we talk a lot about other diseases, but rarely we talk about kidney
Kidney
disease.
disease.
And this is such a timely and informative talk that I think our viewers can bookmark it and save it. You can go back and learn. There is so much of nuggets of wisdom in it.
Yeah.
Thank you, Shobha, and thank you, Arjun. Thank you, Dr. Rayapudis. I try to follow your weekly wellness chats whenever I have time. They're very informational, and I have referred some patients to just look at your website for recipes and resources. The time and the effort that you took to build such a resourceful website, it's all in there. You just have to look, you just have to find where to click. That's all you have to
Yeah.
do. So thank you for Gift of Health, and thanks for having me today.
Oh, thank you so much. It was such a pleasure to have you, Deepthi, and this was such an invaluable discussion. So thank you for your time for doing this.
Thank you.
For our viewers, we will see you next
Next
week.
week.
Yeah.